Hello everyone, thank you for staying around today. I know it's the end of the day, but I'm Camille and I'm going to talk to you about my PhD journey. So, just a bit of background about me. I am a Band 6 physiotherapist. I have about 7 years experience in the NHS. I am rotational, meaning I work pretty much everywhere in the hospital, including pediatrics at times. But my interest is mainly in elderly and acute frailty. So I'm different from Rich in how I kind of got on to my PhD. So I actually applied for an AHP, Clinical Research Doctoral Fellowship role at the Trust back in 2020. And I had an interview and surprisingly got the job. And since then, so my research is with the University of Chichester. I am part-time. Previously, my topic was on perspective memory and dementia, but I soon changed that within the first month starting it because I just didn't feel like I knew enough about perspective memory. So I actually changed it to dementia and mental capacity. It's going to be a PhD for 5 years to complete, hopefully, and then I started back in 2021. Okay. So my title of my project is Improving Mental Capacity Assessments for Patients with Dementia in Acute Care Settings, an Application in Hospital Discharge Planning. It's a really long title. So if any suggestions to shorten it, would be great. The reason why this kind of came up is because during the early part of the pandemic, there was a lot of older, frailer adults, a lot of them with dementia or cognitive impairment, were being put into care or nursing homes without any consideration of their autonomy, basically the right to decide. At the same time, social workers were also removed from the acute care setting. Therefore, they weren't part of that MDT discussion. So then that decision about does this patient have mental capacity to make this decision about discharge was on the doctors, the nurses, the therapists, who at times felt really ill-equipped to make that decision because of limited resources, training, those sorts of things. Based around the rationale, so again, mental capacity assessments, they can be very complex. They involve clinical evaluation, they involve bioethical and legal considerations. They're also essential in the discharge planning, like I said, and they're also essential to get correct, because since the wrong judgment can be detrimental for a person living with dementia, often they are excluded from that decision-making process in hospital, which is really unfortunate. And also their wishes also go unheard and not honored. And this can lead to restrictions on their freedom to decide what happens to them when they leave hospital. So there's inconsistency in the practice, and this is why I wanted to research this. There are tools that have been developed, however, there's not enough about the utility, so how useful these tools are, how effective they are, and also are they accepted by not just the healthcare professional, but the patients themselves. And there's actually no gold standard in how you assess decision-making capacity or mental capacity. And yes, in England and Wales, we do have the Mental Capacity Act, but that serves as the legal definition and framework to assess mental capacity for people over the age of 16. And then, like I said, the problem is there is inconsistencies in how it's being applied. So like I said, when you ask, when do they do the assessment? Well, it's kind of up to when that healthcare professional feels like an assessment is needed. And then the other thing is it's not fully embedded. So sometimes it's done, sometimes it's not done. So I really wanted to look into why this is happening. So projects, so the current status now, and so I am doing data collection, and it is a mixed methods design study. So I am investigating NHS healthcare workers' experience in assessing mental capacity for patients with dementia in hospital. So I first designed a cross-sectional survey that went out to staff, and it's just basically learning about their experience. You know, what is triggering the assessments? How long do the assessments take you to do? What type of training have you done? I've also have how confident you feel about these assessments and your knowledge as well on how much do you know about the Mental Capacity Act, because I think it's really important that if you are going to be doing the assessments, you know what you're actually doing. And then I will be starting hopefully my focus groups next week. And it's going to just give me a little bit more insight into some of the findings from the survey. And then we can talk more in depth about people's lived experience about actually doing these assessments in an acute setting. So then the second project I have, so I have started data collection, so I've decided to do a scoping review because looking at capacity research, there's multiple definitions of what capacity means. And so it was really challenging to find a definition to kind of ground a tool that I was going to make. So I was like, well, I need to just figure out what the literature is saying about what the definition is. And also, when it comes to tool design, there's many tools. Some tools are like guides and aids, some tools are like a clinical framework with a clinical algorithm, some tools are a capacity determination tool. So there's all sorts of tools out there, and none are like a gold standard, like I said. And then following that, I want to co-design a tool with people living with dementia, which is right now currently planning with the research champions. And yeah, it's been really interesting because I really do want to include people living with dementia in this process. So how I designed this PhD is the first half is dealing with people with like healthcare professionals, and then the second half is people living with dementia. Then hopefully I can validate this tool and it can be used eventually, hopefully. Okay, so what I enjoyed most about this PhD journey, so learning new skills, like I did not like Rich. I just kind of fell into it. I didn't think I was going to go into research. After my MSc, I was like, I'm never writing another dissertation ever again. And then somehow I kind of fell into it. And the networking and going to conferences, I've established great networks and great collaboration with people. So it's been amazing doing that, and it's given me variety in my role. And also flexible working. I'm not a morning person, so it's great that I can actually, if I wanted to, I can schedule my day a little bit later. So it's quite nice doing that. So if anyone's interested in doing a PhD, this is a bonus. And then what's been challenging, waiting for approvals. It's not fun. They can cause real massive delays. PPIE, so that's patient public involvement and engagement set up, that's been also a challenge as well. When I started my PhD, I was kind of in the midst of lockdown, kind of end of lockdown, so everyone's kind of isolated in their own little bubble, so it's been really hard to set that up, but I'm finally getting that going and planning. I've had to change my plan so many times, because again, nothing's really concrete when it comes to doing a PhD. Future plans, so immediate, I just want to get my first study done and hopefully I can publish my results and hopefully I can present it next year. And then submit another ethics application for my project, and long term, just to finish my PhD. I think and then after that, really, who knows, I might do a postdoc, I might not, I might feel like after this PhD I'm done, but we'll see. But no, I really have enjoyed it, especially doing research. I didn't think I was gonna like it at first, but I've actually been enjoying it. And thank you for listening. So if anyone is a healthcare professional who works at the hospital, or works at University Hospital Sussex, and would like to participate, I have a QR code for my survey because I'm still looking for more people to get involved. So please sign up. I also have a focus group, so if you just don't even want to do a survey, you can email me. My email is below. But thank you so much for listening to me.